Greetings, loved ones. Protecting other children is an important concern when dealing with children who have sexual behavior problems, particularly if they have acted out with other children in the past. Today we're going to talk about keeping all children safe when one has a child with sexual behavior problems. Please help us get these messages out. Subscribe to our channel. Follow us on Facebook, Instagram, and Twitter. Hit the like button and the notification bell, and please share these messages with others. You could save a life. Again, I will say that protecting our children is an important concern when dealing with children who have sexual behavior problems, particularly if they have acted out with other children in the past. Children who have had sexual behavior problems typically can attend school and otherwise interact with other children as long as they receive treatment for their sexual behavior problems, have appropriate supervision in the school setting, such as direct supervision by an adult during unstructured times like recess or lunch. In such cases, direct communication between the family, the therapist, and school personnel is really important so that a safety or supervision plan can be developed as needed. Children who have sexually acted out with their siblings present a unique challenge for parents and therapists. Children who have experienced problematic sexual behaviors at the hands of their brothers or sisters can have a wide range of responses. Sexual behavior that was threatening, aggressive, or painful can have a profound negative effect on other children. Other factors that may increase the traumatic effect of sexual abuse by a sibling include the length of time that the behaviors took place, such as sexual behaviors that occur over a longer period are more problematic, how many times the behaviors happened, the type and closeness of the relationship among the children, how well the child was functioning before the sexual interaction, such as children who are doing poorly before the behaviors are more likely to be negatively affected, and the response and support received by parents or other caregivers. Some children who experience sexual abuse show almost no reaction or trauma symptoms, while others may experience reactions such as nightmares, a heightened startle response, and avoidance of the sibling, or anything that reminds them of the event. I'm going to insert here also bedwetting. Still, others develop symptoms of depression and anxiety, such as difficulty in separating from parents, behavior problems, social and peer problems, or even inappropriate sexual behavior themselves. If your child has sexually acted out with another child in your home, you will need to consider the safety and well-being of all your children when deciding what course to take with the child who has the sexual behavior problems. If other children in the home express concern about living with their sibling or are showing signs of traumatic stress, the best course for all concerned may be placement outside of the home for the aggressor. Alternative placements may include a relative's home, a foster home, or inpatient or residential treatment. So here are some issues to consider when making decisions about where this child will live. Can you provide close visual supervision for this child and still respond to the needs of your other children? Meaning, if this child's in the home, can you keep the other ones safe? What safety measures can you take to increase the level of supervision and safety in your home? For example, changes in sleeping arrangements. Also consider how severe were the child's sexual behavior problems and how well is the child responding to supervision and treatment. Children with highly aggressive or intrusive sexual behavior, despite treatment or close supervision, should not live with other young children until this behavior is resolved. I'm going to stop here. You have to think about the safety of the other children. I know it's difficult to make these decisions, and I've been there, so I understand. We've had children who were not responding and who were sexually aggressive towards others. Children we loved and adored and raised from birth who were about 10 or 11 years old. It was a difficult decision to separate them out of the home that we had to protect the other children, but we had to protect the other children. And while it broke our hearts, while I collapsed in the driveway after they left, I had to do that to protect the others. So planning for sibling contact and reunification, this should not be done alone. Before bringing a child with sexual behaviors back into your home, you will need to work with a knowledgeable support team to help make safety and treatment decisions. In addition to working with a qualified treatment provider, You may want help from Child Protective Services or Juvenile Services. And I'm going to stop here and insert. Child Protective Services are not your enemies. When they see that you are working to protect the other children and the child involved and to get help, they will work with you. Just remember, they're not your enemies. Their job is to protect the children. So you may also want to take advantage of informal support from relatives, friends, and other supportive adults. Together, you and this team can develop a clear safety plan for bringing your child back home. All members of the family should be involved in developing this plan, and everyone should agree with, understand, and be capable of following it. So this is what the plan should include. Specific rules for the children. Activities the children can do and are encouraged to be able to do. Responsibilities of the caregivers in charge of the children in the home. And rules for all family members regarding privacy, boundaries, and supervision. Remember that the reunification process will and should take time, starting with brief visits and increasing in frequency and duration as you and your family implement the safety plan. Raising a child who has sexually acted out with another child can be incredibly stressful. Many parents and caregivers are so focused on supporting and caring for their children that they forget how important it is to take care of themselves. So I want you to listen to me, Mom and Dad, Grandma, Grandpa, Aunt, Uncle. As you move forward in helping your child heal, be sure to stay aware of your own needs and seek professional help if informal support is not enough. For more information on sexual behavior problems in children, visit the National Center on Sexual Behavior of Youth. That's ncsby.org. We'll have that in our description. According to the CDC, over half of all children in the world, that's 1 billion children ages 2 to 17, experience violence every year. The question is not if you'll encounter a victim of violence. The question before God is, what will you do when you do encounter them? You could be the person who saves a life. Micah 6:8 says, God has showed you, O man, what is good. And what does the Lord require of you? To do justice, love mercy, and walk humbly with your God. That's all action. You are called. We are all called to be champions for justice. If you are a victim, I want you to know that there is a way out. It is not your fault, no matter what anybody says, no matter what you think. Abuse is not love. If someone says they love you and then they abuse you, they're lying to you. And most of all, I want you to know you're not alone. So if you're suffering violence, reach out to someone today. If you find yourself in a dangerous situation, call 911 for help. If you know of a child or other person suffering violence, tell the authorities. In our next episode, we're going to continue this series, and we're going to ask the question, will victims of abuse get over it and heal? Until then, God bless you.